We have additional 16 participants. Okay, so So, as of now, we have 40 participants. Sige, roll call tayo. Okay. Mga present po is si Ma'am Cheryl Loredo. We also have with us from ZZMC PMDT Treatment Center, yung mga staff, si Doc Medina. And we also have from Bucor, si Ma'am Connie. From the RHUs, we have si Ma'am Daisy Manalasa, Ma'am Rachel Guerrero, Crizan Mares. We also have Ma'am Jo Banwa of CCMC. Welcome. Good afternoon po. And then we have Ipil District Jail. Then we also have from Zamboanga City Health Office, mga nurses. And then we have from ZCMC. Oh. Okay, we also got... So, si Ma'am Shirley Mendez, mayong hapon, Ma'am. Si Ma'am Joanne, si Ma'am Maribeth Kitayin. And we also have Ma'am Cathy May Binondo. Si Doc Cheng Valeros is also with us. We also have representatives from Cam Navarro General Hospital. And then from Payao po, si Sir Adelino Tusong. From GCMC TB Dots and Laboratory, si Ma'am Fatiha, si Ma'am Jos Banwa. Dito na po si Ma'am from EPIL, si Dr. Verson. Hi, Doc. And then we also have from CI, si Ma'am Juvie. Si Sir Claudio of Imelda is also with us. Si Ma'am Honey Lee Su is also with us. Si Ma'am Regina Herundio, si Ma'am Samiha Ali Hassan, si Ma'am Mila Grace from Labuan. And also si Dr. Ivy from Labuan General Hospital. Hi, Doc. We also have from Bucor din po si Ma'am Catherine Sally. And then we also have si Doc Myra Aranan of City Health Office Zamboanga City. Hi, Doc. And then si Ma'am Florida Peña Flor is also with us. Sino po itong si number 750430644790? Hello po. And then si Sir Claudio Female, si Ma'am Catherine Bakang, si Ma'am Richelle Kilsay also with us. Sige, sige po. As of now, we have 45 participants po. Welcome, welcome. Good afternoon po, everyone. Forty-five. 45. 45. So I think we can start na po siguro no. We are already 8 in total. So mga 45 po yung mga participants. Okay. So, okay. Again, a few of the webinar reminders. Please use your earphones or headphones to minimize background noise. If you have any queries, suggestions, or if you're encountering any technical difficulties, audio or video, please inform us sa chat box po. And lastly po, please be present at the moment and avoid multitasking po. This is just a 2-hour teleconference to discuss the answers of the 3 exercises for week 1 po. So to discuss the exercise for to discuss the answers for exercise 1, yung patient-centered approach to TB care is Sir Timothy Isa, and then for the exercises number 2, TB screening, and exercise 3, identifying presumptive TB, it will be discussed by Ma'am Isan Bonyao. So without further ado, I will now turn over the microphone to Sir Tim.
Good afternoon, everyone. Today, we will be having our exercises. But before I'll start, I would like to express na we at the NTP team were quite elated with the reception that we had these previous days. Kasi we hear comments, mga suggestions that they go as far as changing their names already into CAF Center daw, into patient-centered approach, or should I say patient-centered TB Dots providers daw. Pero for now, let's wait muna for the final kumbaga verdict of our national team kung ano talaga yung magiging name ng mga dots centers natin. So, for now, ang ipapangalan po natin ay dapat yung name ng facility at saka dapat nilalagay doon na TB Dots service na provide sila. Facilities with TB services. Kailangan i-dictate doon na may mga nagbibigay tayo ng TB services, no? So hindi siya CAF center muna kasi we heard sa NCR CAF center na ang nilalagay nila sa mga DOTS facilities nila. So I would like also to apologize yung mga previous videos natin kasi because of the quality, the audio and the video, it's quite mahina siya, no? We only recorded it, but rest assured in the future videos, lectures, we will be having a far better quality of the video. Okay? For the first question, feel free to key in your answers. True or false lang. The institution of patient-centered in TB, ano ko tatanggalin? Cannot read. TB recognizes the patients as an important partner in decision-making process on the diagnosis, treatment, and management of TB disease. True or false ba to? Very easy lang kasi walang mali sa statement na yan. So the answer is, of course, true. Second question, addressing the patient's social and economic conditions underlying the occurrence of TB disease does not in any way significantly impact tuberculosis care of the patient. True or false? False kasi nag-i-impact siya ng it is indirectly or directly impacts or significantly impact the tuberculosis care of the TB patient. 3, I would like you to key in your question dito sa number 3. Okay? Please write your answers, A, B, or C, or D ba ang answer. As you can see, italicized ang word except. So, development of a comprehensive treatment and care plan should take the following into consideration, except daw. So, ano ang mali sa statement sa binigay na choices? Use of standardized patient and care plan. B, review and update plan monthly based on both clinical and non-medical needs of patients, example in social, psychological, and economic. And C, prioritize patients with high probability for treatment, cure, completion of supportive care. And D, ensure confidentiality of patient information. So what is the correct answer? Please key in your answer. I think the hint there is, do we really need to assess if the patient is magiging cured ba siya o completed? Saka natin siya bigyan ng, what do you call this, priority? Of course not, kasi the correct answer is C. Madaming answer. Number 3, That is the correct answer, letter C. Number 4, location of treatment as prepared by the patients can be A, at home, B, workplace, B, both, C, both, or D, neither. So what is the correct answer? Please key in your answer. Okay, most of them answered C. That is correct. Kasi if you, the only choices that given to us was home and workplace. If you would like to expand this, we could have other choices such as if the patient would like to drink the medicine in a certain mall or sa park, pwede siya. That is part of the patient's centered approach that we are having now. So both at home and workplace ang sagot, which is letter C. Number 5, treatment supporters for patients treated at the community level can be anyone of doing except, ano ang correct answer dyan? Do we have any exemption or do we need to find someone pa specific to be a treatment partner? Of course, no exemption kasi pwede siyang community volunteer, pwede siyang family member oriented on the treatment of TB, and pwede siyang both. We could expand this into lay ministers, neighbors, or anyone residing in one home, in one roof with the patient. So there is no exemption for as long as you gave an orientation to the treatment supporter. That is what is important. Especially, we should take in consideration, treatment supporter should be someone who can exercise authority over the patient. Mas maganda yun pag ganun. 6, the provision of nutritional support to patients on treatment could be accorded with A, conducting baseline periodic nutritional through computation of the patient's BMI. B, nutritional advice from a nutritionist in promoting build-up or nutritional rehabilitation. C, both, or D, neither. What is your answer? Most of them answer letter C. Parang nagla-licensing exam lang sila, no? The go-to answer is letter C, which is correct, both A and B. How many participants do we have now? 60. Welcome to the newcomers. 64 participants. Shout out to our Zamboanga City Medical Core Team Group in Zamboanga City Health Office. Number 7, true of palliative care. So most likely ano lang ang definition ng palliative care dito, no? Okay. Chinek niya PDM. Sorry, I accidentally muted myself. Am I loud and clear? Please key in your ano? Yes. Yes na daw. For some, wala pa daw. More feedbacks before I'll proceed to the next. Loud and clear. Very good. Number 8. What is the correct answer? Kasi I think this question is very timely in this time of pandemic kasi most of our patients are experiencing depression and some of them are very anxious of their situation. So what do? We need to assess, which is both A and B. Okay, we need to assess their mental health. Number 9. TB patients with the following comorbid condition are appropriately managed and treated during the course of the TB treatment. A. Patients on illicit drug use, mga drug addicts. B. Patients with excessive alcohol use or yung mga alcohol dependent, mga alcoholics natin. C. Both or D. Neither. What is your answer? Some answered C, some answered both. But the correct answer is, of course, both. Kasi we need to address the comorbidity at saka ano ang status or state ng patient natin ngayon. We cannot treat our patients on TB drug if they are currently drug addicts. Kasi most likely, they will fail or they will not complete the treatment. Okay? Number 10. The following are important policies governing patient-centered approach to TB care except. So ano yung mga except dyan? This is quite lengthy and worthy. Letter A. The impact of poverty and food insecurity on TB diagnosis and treatment shall be recognized and addressed by linking TB patients to social protection measures. Correct ba siya? B. Psycho-emotional support and protection from social isolation or discrimination shall be provided to all TB patients. Is this statement correct? And C. The patient's physical comfort, safety, and wellness shall be maximized by providing evidence-based integrated care for TB and other comorbidities. You must take in consideration this is always repeated. Physical comfort of the patient, safety and wellness should be addressed or maximized. And letter D, do you think this statement is correct? That throughout the continuum of TB care, patients can only participate in deciding on their treatment and management when permitted by their provider. Tama ba as provider or health care personnel? Do you need to give your permission for the continuum of TB care of the patient? Of course, no. Kasi this is what patient-centered is about. We need to incorporate our patient's opinion and suggestions in the TB management. 11. Patient-centered approach to TB care except. So what is the statement that is kumbaga wrong in this certain question? A. Allowing patients to miss out on their doses after several vomiting episodes without any adjustments or modification to the treatment regimen. Tama ba siya? Do you allow to miss out a patient sa treatment niya without even adjusting their medication? Kasi we at DRTB patients, no, what do is we just change the regimen, but we never allow the patient to miss out on the doses. So quite given ang answer dito. B. Treatment administration can be done at the location that is convenient to the patient, which is correct. If gusto ng patient sa mall, sa park, or wherever the patient wants to get the medicine, so be it. C. Issuance of medical certificate for the patients upon completion of the treatment to reassimilation to workforce. Am I too fast? Kaya lang. Sige, I'll take this very slow. Sa letter C, I would like to expand this one. No? Our medical officers or our doctors could already issue medical certificate if the patient already started the treatment. Actually, the statement may be very controversial, but actually after 2 weeks of treatment, TB patients are already considered sterile. So pwede na siyang bigyan ng medical certificate. Letter D, monitoring the clinical progress of the rehabilitation of previously drug-dependent patient while undergoing the TB treatment. I think I'm very clear with my choices that the correct answer, or which is wrong, except is letter A. We never allow patients to miss out the treatment. Daily pa rin ang treatment, okay? Ang pag-inom ng medicine. Number 12. measure contributing to providing emotional support and encouragement to the Sorry, am I clear? Clear na po, ma. Sige. Number 12. Nawawala yun. Measure contributing to providing emotional encouragement to the patient in reducing social isolation and improving treatment adherence. So ano yung mga measures niyan? Letter A, conducting periodic patient satisfactory surveys. Tama ba? Makakatulong ba yun? No audio still? Hindi na siya mute. Am I clear? Kay Ma'am Elaine? I would suggest you would check your local connection kasi dito, hindi naman siya nakamute ang mic and we have perfect bandwidth coming from IT. And other participants are have their own audio naman. Nakikinig naman sila. So anong sagot dito sa number 12? A, as I was saying, conducting periodic satisfaction survey. Nakaka-improve ba yan sa patients' isolation? Sa pag-reduce ng isolation, self-isolation? Or B, support of peer and patient support groups, including patient support hotlines and digital support groups. Ang pagbuo ba ng mga support group ng mga patients, especially testimonial cases, patients who are previously cured in your institution, makakatulong ba yun sa patients sa pag-improve ng treatment adherence ng mga currently taking their medicine? Or C, counseling on pregnancy during DRTB, which is very, kumbaga sa mga choices, ang C ang pinaka malayo ang sagot. And D, providing interpersonal communication and counseling to empower the patients to participate in decision-making in their own treatment. So key in your answer. Number 12, the correct answer is, you got it all correct, B. Kailangan nyong magbuo ng support group. And all you have to do is look around. Those are previously treated patients can serve as a testimonial cases for the patients who are currently taking the medicine. Hindi ito pwede man next. Somehow, nag-lag lang for a while. Please bear with us. Yeah. Okay, moving on. Number 13, are we all on the same page? Key in your answer. Supportive elements and procedure under maximizing physical comfort, safety, and wellness of the patient, except A, palliative care for patients who cannot be cured. B, regularly monitoring and promptly treating side effects and adverse drug reactions. C, treating and referring for comorbid physical conditions that affect the patient's ability to reach cure. Or D, linking patients and family with community-based organization providing treatment adherence support group. And most of you answered D, which is correct. Number 14, options for financial assistance to DS and DRTB patients to support diagnosis and treatment adherence includes the following except ano daw? Key in your answer. Most of you answered letter D. Of course, hindi lang pwedeng microfinance scheme or support to income generating activities, yung mga small medium enterprise being provided to us by DTI. Pwede din tayong pumunta sa other facilities, other government services such as SSS, DSWD, which includes supporting their medicines, ancillary drugs nila, especially if the patients has comorbidities. So pwede yun. Hindi lang pwedeng microfinance scheme and support to income generating activities. It could be expanded into other government services na pwedeng ibigay sa patient. Okay? Number 15. The Department of Labor and Employment or DOLE Executive Order 0573 on non-discrimination is commendable example of protection for patients integrated in the workplace from stigma and discrimination. Key in your answer, true or false? Of course, the correct answer is true. Walang mali sa statement na ito. Number 16. Organizing physical rehabilitation after cure of patients, of TB patients to be particular, is a supportive elements under the policy of A, respecting patient autonomy and efficacy, C, providing psycho-emotional support and protection from social isolation and discrimination, or C, maximizing physical comfort, safety, and wellness. I think this statement has been repeated once over again, I was saying. And letter D, financial assistance to the DRTB patient to support diagnosis and treatment. Okay, in your answer, the correct answer is letter C. So always take in mind maximizing physical comfort and safety of and wellness of the patient, not of the health personnel, but of the patient. Number 17, which of these physical impairments as a result of TB treatment should be considered for rehabilitation? Key in your correct answer. Overwhelmingly, the answer that you key in is hearing loss. Of course, hearing loss. Kasi we cannot do something about hyperpigmentation, macular rashes, and gynecomastia. And most of our patients are really having a difficulty in hearing already kasi especially before when we had streptomycin. And one of the culprit is really hearing loss. Sa mga DR, we had injectables before. And one of the patient's symptoms that they have a hard time hearing or they have a buzzing sound. Number 18, true or false? Key in your answer. As a serious public health issue, confidentiality should be waived regarding the presence of an employee being ill with TB and can be divulged to concerned employees in the work. Tama ba? Madaming nag-answer ng A. True daw? Hindi, kasi you cannot divulge the information of the TB patient to their co-employees. The only personnel, which is the health personnel, ang pwede natin bigyan ng information about the TB patient, especially if the health personnel is directly, what they call this, managing the case of the patient. So pwede siya sa nurse, company nurse, pwede siya sa school nurse, but never to the co-employee. So the correct answer is B, false. We are protected also by Data Privacy Act still, okay? Number 19, the use of an individual treatment and care plan for the TB patient should include aspects that may influence the completion of the patient's treatment, such as A, social, structure, and family support, B, financial capacity, C, psychological status, D, A and B, or C, which is all of the above. E, I'm sorry. So what is the correct answer? Key in your answer. Yes, you are all correct. The correct answer is all of the above. Okay. Number 20, information pertaining to TB literacy to the patient should include the following. So what does this mean? This question, TB literacy, meaning these are the health education that we give to our patients prior to enrollment sa TB treatment. So ano yung mga ini-encompass during sa pagbigay ng health education to our patient? Does that include disease transmissibility and infectiousness? Does this include latent tuberculosis infection and differences between TB and drug-resistant TB, or A and B lang, or all of the above? Key in your answer. I think madaming makaka-perfect sa module 1, no, sa exercise na to. And the correct answer is, of course, all of the above. When you give health education to the patient, you might as well give all information necessary to the patient. Number 21, prejudicial perception of TB patients leading to unjust distribution or deprivation of services and non-acknowledgement of their rights is very ano siya, no? Parang it has something to do with law. So what is your answer? Most of them answered B, which is correct, discrimination. Of course, discrimination, ito yung parang, this is the kind of case that we could put to our patients, no? And it is not stigma. It is always discrimination. 22, a treatment supporter can be only at the following, any of the following, except What is your answer? Number 22. I think dito tayo magkakaano. Some of you answered B, some of you answered D, but the correct answer is letter D, none of the above. Kasi a treatment partner can be anyone for as long as they are oriented on how to manage TB. They are oriented on the basic, such as giving information on the misconceptions on what we have about TB, etc. None of the above. 23. Palliative care refer to the following patients. A. Patients who cannot be cured. B. Patients who refuse treatment. C. Both A and C. Or D. None of the above. Key in your answer. The correct answer is letter C. A and B. Madaming nagkamali dito, no? So palliative care should be offered to the following patients who cannot be cured and those who refuse treatment. So even though they refuse treatment, they should be given palliative care still. May nagsusulat. May naka-annotation. We would like to ask our participant, avoid giving annotations kasi some of you are annotating the correct answer already. Number 25. The question is, this would be the last question on our first exercise. True of the policies on patient-centered care approach except anong statement dito ang mali? A. Health workers shall respect patient autonomy and support self-efficacy. Is this statement correct? B. Health workers, I would like to emphasize again, health workers' physical comfort, safety, and wellness shall be maximized. Ang health worker ba ang dapat natin i-consider na magkaroon ng physical comfort and safety and wellness? O ng patient? Letter C. Psycho-emotional support and protection from social isolation or discrimination shall be provided to all TB patients. Or D. Link TB patients to social protection measures. So this is a trick question. The correct answer is B. Hindi ng health workers, kundi ng TB patient. So I think that ends my slide. But before I give this floor to Ma'am Is, I would like to end siguro the exercises by saying na I think it's about time that we should change. We should have a mind shift that patients should be treated as client but not as mere patients. So meaning to say, without our clients, we, the health personnel, will have no job kasi they are our clients. So it's about time that we should implement patient-centered approach to every patient that we have. Meaning to say, we should be culture-centric, we should be obliging of their religion, of their personal beliefs, etc., etc. So that would end my module, and I would like to give the floor to Ma'am East Halil, to Ma'am Steph.
Okay, good afternoon. Thank you, Sir Team, for the rationalization of the exercises, of the questions in exercise 1. So, let's have a 5-minute mobility break para yung gustong mag-CR po or gusto mag-coffee break,
Hello, maayong hapon sa tanan. Buenas tardes a todos. Can everyone hear me? Can I have a response? Hello, thank you, Ma'am Bambi. Hi. Welcome to all our participants from Zamboanga, Sibugay, Zamboanga City, Isabela City. We have also from Basilan and Sulu. So welcome po. So this is our afternoon session. We already had our morning session with Norte and Sur. So ayan po, ngayon naman po ang batch ninyo yung aming representa ng ating mga exercises. Ayan. So welcome po once again. So we will now proceed with our discussion for exercise number 2, TB screening. So for question number 1, this refers to a facility, whether public or private, that provides the entire spectrum of TB services in accordance with the policies and guidelines of the National TB Control Program. Okay, so I would like to ask everyone to be participative, no? You may key in your answer to our chat. So we have the following options. Letter A, DOTS facility. Letter B, PMDT Satellite Treatment Center. Letter C, is it health facility with TB services? Or letter D, none of the above? What is your answer to question number 1? All right, I can see overwhelming letter C here. Ayan. Medyo mahina ang audio. Naririnig po ba ako ng malinaw? Ayan, thank you so much po. Salamat. Ayan, naririnig naman po ako ng malinaw. Paki-adjust po siguro ng audio on your end or it's your internet connection po. Thank you so much for your response. Now, the correct answer here is letter C. Now, this is the newest name of the of our TB DOTS facility. So, it's because DOTS is an old strategy na po, no, of the TB program. So, hindi na po tayo nag-advocate ng directly observed treatment short course kasi sinusulong na po natin ang patient-centered TB care as discussed ni Sir Tim earlier. So, ang bagong pangalan na po ng ating mga facilities ay Health Facility with TB Services. Ayan. So, for example, Health Facility with TB Services, IPIL. Ayan. Health Facility with TB Services, GIWAN. Yan. Yan na po yung magiging pangalan ng ating mga facilities. Okay? Tandaan po yan, ha? Let's proceed to question number 2. Symptom-based screening includes asking about the 4 signs and symptoms of TB at least 2 weeks duration or longer of any of the following, except A, night sweats, B, cough, C, unexplained fever, D, unexplained weight loss, or letter D, none of the above. Ayan, maraming salamat po sa mga sumasagot. Naaalala pa po nila yung tamang sagot doon sa links na binigay po natin. So thank you so much po. Our correct answer is, of course, letter E. So paulit-ulit po nating i-mention all throughout the exercises, no, kung mapapansin po nila itong 4 cardinal signs and symptoms para talagang ma-engrave po sa mga utak po nila. So again, the 4 cardinal signs and symptoms of TB, 2 weeks na po yung tinitingnan natin or longer. That includes night sweats, cough, and unexplained weight loss. Okay, let's proceed to question number 3. This refers to the systematic identification of people presumed to have active TB in a predetermined target group using rapid tests or examinations or other procedures. What do we call this? A, case holding, B, systematic screening, C, passive case finding, or D, contact tracing. Ayan, I can see letter B sa mga chat groups, mga baha po ng letter B. Thank you so much. Zamboanga City Jail for joining us. ZCMC health personnel, thank you po. Welcome. Ayan, we also have participants from MCS and EPIL. So the correct answer po for that tama po kayo. Letter B, systematic screening. So, yan po yung talagang isa sa mga key terms po natin sa 6th edition MOP. Okay? So, let's proceed with question number 4. Presumptive TB refers to any person having A, 2 weeks or longer of any of the following: cough, unexplained fever, weight loss, and drenching night sweats; B, chest x-ray findings suggestive of TB; or C, all of the above. So when are we going to say that the person is a presumptive TB? Yan. It's raining letter C sa chat group. So this is an easy question. The correct answer is, of course, all of the above. Yan. So let's move on. Question number 5. Among PLHIV patients, at the time of diagnosis and annually, the following procedures for systematic screening shall be done. Sa PLHIV, no, pagpasok po sa health center or sa hub at nalamang PLHIV siya and annually. What are we going to do to assess the patient for TB? Is it A, we are going to screen for signs and symptoms of TB? B, we are going to ask for signs and symptoms of TB plus chest x-ray? Letter C, are we going to request for chest x-ray only? Or letter D, are we going to collect one sputum for expert test? Ayan, so all answered letter B, symptoms plus x-ray. So tandaan po nila, the correct answer is letter B. So for this specific tawag dito, frequency po, no, diagnosis upon diagnosis, and every year po, once a year po. Screening, signs and symptoms plus X. Now, among PLHIV, the following systematic screening procedures shall be done naman during visit. During every visit. So what are we going to use? A, or how are we going to assess our patients? A, screen for TB signs and symptoms. B, screen for TB signs and symptoms plus chest x-ray. Letter C, chest x-ray only. Or letter D, collect one sputum for expert test. So yung kanina po, upon diagnosis and every year, ito naman po every visit. Okay, noted, Ma'am Jo. Nasabungan ako na po ang mic. Ayan, so almost all answered letter A, signs and symptoms only. The correct answer is indeed letter A, screen for TB signs and symptoms. So kawawa naman po, no, yung PLHIV natin pag every visit siyang i-x-ray. So ayan po, signs and symptoms lang po every visit. If not on TB treatment pa. Okay, let's proceed to question number 7. Presumptive pulmonary TB in children include all of the following except A, unexplained fever of 2 weeks or more after common causes such as malaria or pneumonia have been excluded. B, coughing or wheezing of 2 weeks or more, especially if unexplained. C, unexplained weight loss or failure to thrive of 2 weeks or more not responding to nutrition therapy. Or D, none of the above. Okay, and your answer. So we are already talking about presumptive pulmonary TB in children. Okay, so mukhang unanimous po yung sagot na letter D. The correct answer here is letter D, none of the above. So lahat po ito, no? Signs and symptoms suggestive of TB in children. So we can tag our patient as presumptive TB. Ayan. Okay, moving on to question number 8. This area is included in the targeted community workplace, and congregate settings for active case finding? A. Parking lot. B. Waiting shed. C. City jail. Or D. People's Park? Go. Ayan. So halos bonus question po ito, no? Saan po tayo madalas mag-ACF? At nagdadala ng mobile x-ray. Ayan. So, syempre, ang daming sagot ng City Jail, oh, C. Talagang pinagdidiinan na C. So, indeed, it's letter C, City Jail. Ayan. Okay. Question number 9. When do you conduct systematic screening among healthcare workers? A. Baseline upon recruitment. B. Biannual. C. Annual. D. All of the above. Go. So I'm pretty sure natatandaan niyo pa po yung mga sagot, no? Kasi nakikita po agad, nag-generate po agad ang correct answer sa inyong exercises. Ayan. So letter B, natatandaan po. So this is one of the highlights, if I may add, of the 6th edition NTP MOP. So talagang ine-emphasize na po na talagang we are putting attention to our healthcare workers na rin and not just our patients. So we have to look after our selves din po. So in this module, we talked about how and when are we going to screen for our healthcare workers. So for this, when are we going to conduct systematic screening? So the correct answer is letter D, all of the above. So may mga explanation po sa mga next questions po natin. Kailan po ginagawa ang baseline upon recruitment? Kailan po ang biannual? And kailan po every year? So ito po yun. Question number 10. Upon recruitment of a healthcare worker, a baseline examination will be done using A. TB symptoms only, B. TB symptoms and chest x-ray, letter C. Expert test and TST, or letter D. Chest x-ray only. Ayan. So, ang sagot po dito, sumasagot po lahat ng letter B. Ayan. So, pagka-hire pa lang po ng empleyado sa RHU po ba or sa health center or sa hospitals, no, kahit sino po yan, janitor, nurse, midwife, utility worker, ayan. So, everyone po ay kailangang i-assess po natin for TB and pagpasok po nila, TB symptoms plus chest x-ray so that we have a baseline, no, we can compare kung may nagpo-progress na TB sa chest x-ray po. Ayan. Now, let's proceed to question number 11. Biannual screening of a healthcare worker include which of the following procedures? Ito naman, twice a year. Ano po yung gagawin natin? A. Assess for TB symptoms only. B. Assess for TB symptoms and do chest x-ray. Letter C. Do expert test and perform TST. Or letter D. Letter D. Do chest x-ray only. So nakita na po nila, no? Yung sagot po natin dyan ay letter A, of course. So pag 2 times a year, wala na pong x-ray. Tanong-tanong na lang po tayo nung cardinal. Ayan. Okay, we are on question number 11 na po. A DSTB household contact should be evaluated within how many days upon initiation of treatment of the index case? Letter A, 1 day. Letter B, 10 days. Letter C, 7 days. Or letter D, 4 days. Ayan. So, pag pumasok si patient sa RHU at i-enroll po siya, for TB, kailan po natin ite-trace yung ibang mga kasama niya sa bahay? Ayan. So the correct answer is as much as possible within 7 days po. Ayan, upon initiation of treatment. So tatanong na po natin lahat, may mga bata po ba sa bahay? Mayroon po bang kapatid, asawa, or ibang nakatira, katulong, di kaya? So we can assess po, or we can assess kung pwede po natin siyang ETB preventive therapy or yung tinatawag natin sa old MOP na IPT. Or we can also diagnose kung baka nahawaan na talaga. So ayan po. Now, let's move on to question number 13. All DSTB and DRTB contacts who have no signs and symptoms of TB and with chest x-ray not suggestive of TB will be advised to follow up for A. Symptom screening every 4 months and chest x-ray yearly for 4 years. B. Symptom screening every 6 months and chest x-ray yearly for 2 years. Letter C. Symptom screening every month and chest x-ray every 6 months for 2 years. Or D. Symptom screening and chest x-ray yearly po ba ito? So we have a question here. Do we have form for it? So that will be discussed po in our module 11, recording and reporting po, Ma'am Jo. Okay, we are flooding letter B in our chat box. So the correct answer here is letter B. So contacts po yung pinag-uusapan po natin dito ha, hindi po yung pasyente. So pag wala pong signs and symptoms, we are just tracing. So every 6 months, tatanungin natin yung mga kasama sa bahay kung about the cardinal signs and symptoms. And then at least once a year, chest x-ray. That is for 2 years po. Ayan. Okay. Mabilis po ba ako or do I have to slow down? Type okay lang po kung okay lang. Okay, thank you, Sir Earl. Okay lang. Thank you, Ma'am Fatima. Okay, I shall proceed. Okay. Moving on. Question number 14. Which of the following belong to the DRTB high-risk group? A 67-year-old patient complaining of cough of 2 weeks with no history of TB treatment. B, a 14-year-old patient with no history of TB treatment. C, a 30-year-old patient who only finished 4 months of treatment complaining of cough for 4 days. D, a 40-year-old patient complaining of cough for 10 days and currently incarcerated. Go. Okay, sumasagot po lahat ng letter C. So, DRTB na po tayo ha. MDR na po yung pinag-uusapan. Who among them is considered high risk? So, the correct answer here is letter C. So, what's the keyword here? Ano po yung keyword natin dito? Ba't po siya naging DRTB high risk? Anyone po? Ayan. Thank you, Doc. Only finish 4 months. Ayan. Ayan. Basta may history po ng TB treatment. Thank you, Kim. Hindi natapos ang treatment. Okay. Ayan. Let's proceed to question number 15. Refers to a patient who was previously treated for TB, who has been declared cured or treatment completed in their most recent treatment course and is presently diagnosed with active TB. Now, what do we call this particular patient? A, treatment after failure. B. Relapse po ba ang patient na ito? C. Treatment after loss to follow up? Or D. Previous treatment outcome unknown? Go! So dito po wala naman pong nagbago. Ito pa rin po nung 5th edition MOP. Ayan. Ang pasyente pong ito ay gumaling na or na treatment complete. Pero bumalik po ulit ang sakit. So ang tamang sagot po ay relapse. Ayan. So chicken po ito sa ating trained na on the 5th edition MOP. Okay, ito naman po. Question number 16. Which of the following is a TB registration group? A. Treatment after failure. B. Cured. C. Lost to follow up. B. Not evaluated. Sige nga po. Yan, marami pong sumasagot ng treatment after failure. I'd like to ask Ma'am Jo Banwa, Ma'am, why is it treatment failure is a TB registration group? Please, Ma'am. Short answer lang, please. Ayan. So, ano po yung explanation natin dito? May sagot po ba si Ma'am Jo or anyone? Ayan, and may sagot si Ma'am Jo. Because B and C are treatment outcomes. Tama po. Apo, ayan. And also D, of course. Ayun. Okay. Moving forward. Thank you, Ma'am Jo. Thank you, sir. Claudio Junexus. Ayan. Thank you for answering. Next question. Presumptive pulmonary TB refers to any person having the following except A. Chest X-ray findings suggestive of TB. B. One week of cough. C. 2 weeks of unexplained fever. Ito, madali lang po ito. Giveaway question. So the correct answer here is letter B. Bakit po? Bakit po hindi siya kasali? Ubo din po naman ito ah. Bakit po kaya? Ayan, sabi ni Doc Susan, kasi 1 week lang yung nakalagay. Sabi ni Ma'am Fatima, kailangan 2 weeks po yung ubo. Ayan, yun din sabi ni Doc Amilasan, Sir Claudio, and sabi din ni Dr. Anudina, kasi 1 week lang ang nakalagay. So, tama po yun. Thank you so much for your prompt response. Okay, moving forward. Question number 18. Refers to a person who shared an enclosed space with a patient, with a TB patient for extended periods of time during 3 months prior to diagnosis. So, what do we call this person? A, index case. B, is it a child or children? C, close contact. Or D, none of the above. Ayan, madali lang po ito, no? So, the correct answer here is, of course, close contact po ang tawag dito. Ayan. Okay, question number 19. A facility providing rapid diagnostic tests under the leadership of the National TB Control Program is called A, PLHIV, B, PDL, C, ITs, or D, RTDL. Ayan, maning-mani din po ito. Everyone's familiar with our acronyms, of course. People living with HIV. PDL po ang ating persons deprived of liberty. Ayan, ito po yung tamang sagot po, tamang tawag sa mga prisoners po natin. Hindi po prisoners. Instead po, PDL. And of course, it's not C because ITS is Integrated TB Information System. And so, it is letter D, Rapid TB Diagnostic Laboratory. Ayan. Question number 20, malapit na po tayong matapos. To identify presumptive TB in targeted high-risk groups, if chest X-ray is not available, one of the following can be done by the health worker. Is it A, i-refer sa ibang city or sa kapitbahay na munisipyo? Letter B, do expert. Letter C, doctor will decide if patient is a presumptive TB based on clinical assessment. Or letter D, wala lang, do nothing. Ayan, so syempre po, nasa discretion na po ni Doc kung tatawagin ba natin presumptive TB si patient. Okay? So that's true po. For example, our diabetics po, ayan, one of our risk factors. So as much as possible, we will do chest X-ray, but if not available, ayun po, pwede na po nating matawag na presumptive TB po sila with their cough of any duration. Ayan. Ayan, question number 21 na po tayo. In systematic screening in health facilities, the following are included as risk factors except A, bystanders, B, contact of TB patients, C, smokers, D, healthcare workers. Ayan, so syempre po, bakit po yung tambay hindi? What if po umiinom po yung tambay, hindi po ba siya kasali sa mga considered na may risk factor? So wala naman pong nabanggit dito, no, na masyado naman po tayong judgmental kung ganon. So the correct answer here is yes, Doc. It's vague. Wala namang description. So bystanders lang. The rest are clearly part of risk factors for tuberculosis. Moving on, question number 22. In systematic screening for EPTB, we are talking about EPTB now. The following will be noted by healthcare workers except A, gibbous, B, flatus, C, neck stiffness, D, pericardial effusion. Ayan, madaling-madali po ito. So the correct answer here is, of course, letter B, flatus. Ayan. Okay. Let's proceed to question number 23. A patient went to your facility for consult and was identified as a presumptive TB upon systemic screening. During interview, the patient presented a document from a private physician that he completed 2 months of HRZE and 4 months of HR of TB treatment in his clinic. Which risk group does the patient belong? A, DRTB low risk group, B, DRTB high risk group, C, both A and B, or D, none of the above. Ayan. So, may mga keywords pa rin po tayo dito, no? Ay, may mga sumasagot po ng B, may sumasagot po ng A. Sige po. Ano pong tamang sagot dyan? So, the correct answer here is letter B. DRTB high risk group po siya. Kasi, nakainom po siya ng gamot in the private clinic. Yan. Okay, moving on. Hindi po ba na-confuse doon? Yes. Tama po yun, Doc. So, tama po yun, Doc Susan. So, previous completed treatment po siya before and then na-identify po ulit as presumptive TB. Therefore, baka po DRTB na po si patient and we need to assess further. Moving on. Question number 24. A 44-year-old patient consulted at your clinic because of 15 days cough and 7 days low-grade fever. The patient has taken 2 months of HRZE S plus levofloxacin from a private physician last year. Which risk group does the patient belong? A, DRTB low risk group, B, DRTB high risk. Letter C, all of the above, or letter D, none of the above. Ayan. So, marami pong sumagot ng letter B. DRTB po siya. Bakit po ulit? Ano po yung mga keywords natin dito? Marami pong clue, no? Isa pong clue dito ay, ayan, nakainom po siya ng gamot for 2 months na. And another clue na presumptive po siya ay may 15 days cough. So, nakadagdag po yun, presumptive, DRTB, high risk group po yung ating patient. Ayan. So, we are down to our question number 5. A 68-year-old patient consulted at your facility with cough for more than 2 weeks. He came to your clinic with complaints of chest pain, difficulty of breathing, and fever for 3 days. He has no previous TB treatment nor TB exposure to anyone. Which risk group does the patient belong? A, the RTB low risk group, B, the RTB high risk group, C, none of the above, D, all of the above. Ayan. Ano po yung sagot natin dyan? Low risk or high risks ang ating senior citizen? So the correct answer is low risk group lang po. So hindi naman nabanggit na nakainom po siya ng gamot at hindi po din nabanggit na may contact po siya. Yes. He has no previous TB treatment. Ayun. Okay. For question number 26 naman po tayo. A 4-year-old boy was brought to your facility. The child has been experiencing cough for 3 weeks, unexplained fever for 2 weeks, and loss of appetite. The child has no history of any TB treatment and could not expectorate. So typical scenario po, no? Mahirap po talagang kunan ng specimen ang bata. Chest X-ray result revealed bilateral upper PTB. So which risk group does the patient belong? A, the RTB low risk, B, the RTB high risk, C, none of the above, or all of the above. Ayan. So, the correct answer here is letter A. So, low risk lang po si boy, si young boy. Ayan. Okay, moving on to question number 27. A patient has coughing for 8 days upon consultation. She verbalized having fever at night for 5 days and chest pain. She has no previous TB treatment nor TB exposure to anyone. So upon interview, you found out that she has DM type 2 and is on metformin for 2 years now. Which risk group does the patient belong? A, the RTB high risk group, B, none of the above, or C, all of the above. Ayan. So ano pong sagot natin dyan? So the correct answer here is letter B, none of the above. Okay? So hindi po siya under high risk po for DRTB. So, moving forward to question number 28. A 34-year-old housewife, she lives with her husband and 2 children in an apartment. She came to the clinic because of enlarged cervical lymphadenopathy, non-painful, 7 days of fever, cough and back pain, and with no history of TB treatment. Upon interview, you found out that her husband is a confirmed MDR-TB. Which risk group does the patient belong? Ito, madali lang po ito. Ayan, sagot po. Ayan, you can see letter B's in the chat box. So definitely po, no? Maning-mani po ito. Contact po siya ng MDR-TB patient natin. So the correct answer here is letter B, DRTB high risk group. Ayan, last 2 po. Last 2 questions po tayo. Question number 29. The DSSM result of a patient on regimen 1 in your facility turned out to be 2+ on the second month of treatment. Which risk group does the patient belong? A, the RTB low risk group, B, the RTB high risk group, or C, none of the above? D, all of the above. Ano pong sagot natin dyan? So, bigla pong nag 2+ sa second month si patient. Kahit umiinom po ng gamot. Yes, ayan, kiniin na po ni Ma'am Jo. Yung keyword po natin dyan is non-converter po ang ating pasyente. Or if negative siya, biglang positive po yung DSSM. So the correct answer here is the RTB high risk group patient natin. And this is our last question. Mass screening by chest X-ray for all, regardless of TB signs and symptoms, should be done to the following groups. A, all ages 15 years old and above. B, all adults and children. C, all adults, special po yung ating senior citizen, 6 years old only, sila lang po ba? Or D, none of the above? So medyo tricky po ang question na ito. So when we say mass screening po, we only do this sa mga high-risk group. So definitely, no, may mga risk factor po sila for TB. So kailangan pong i-chest X-ray lahat. And by lahat, we mean lahat po ng 15 years old and above. So kung natatandaan niyo po, nabanggit doon sa ating TB screening module na 14 years old po and below yung ating children, it's not recommended po, hindi po recommended ang routine screening gamit ang chest X-ray unless contact po sila ng isang confirmed TB patient. But for this, lahat screen all po tayo in a mass screening. So, for example po, nasa jail po tayo, nagdala po tayo ng mobile chest X-ray machine. So, kahit hindi po inuubo yung ating PDL, ay ine-X-ray pa rin po natin. So, yun po. Ayan. So, congratulations for completing exercise 2. So, thank you po sa lahat ng mga nag-participate. Ayan. So, rest po muna. Galaw-galaw po ulit before we proceed to exercise 3. We are now serving your virtual snack. Masarap po ba yung virtual ensaymada at saka Del Monte pineapple juice? Ayan po. So, ganito po muna tayo, no? Ganito po muna yung setup natin habang hindi pa po allowed ang face-to-face. And thank you so much for your commitment sa first week po ng ating training month. Thank you to all who accomplished the exercises on time. And meron po kaming special announcement about that after po ng ating exercise 3. Ayan, virtual pabalot daw din, sabi ni Ma'am Jo. Yes, ma'am, piniprepare, sabihan lang po namin yung nag-serve. Noted po. Ayan. Ito po, exercise 3 na po tayo. So, marami po bang sumakit ang ulo sa exercise 3? Kasi parang notice namin, yun yung may konting sagot. Natapos na nakaka 300 plus na all over region yung nag-answer ng exercise 1 and 2. Samantalang yung exercise 3, very few, may difference po ng mga nag-take ng exercises. So, if sumakit po yung ulo, paki-type po ng smiley. Patingin nga po, sino yung mga sumakit ang ulo? Yung iba sumagot ng yes, definitely. Ayan, sumakit ang ulo ni Ma'am Crizan. Ayan. And si Ma'am Kat Patang Ulo. Hello to all our Bucor staff na nanonood or nag-join po ng ating exercises ngayon. Ayan, si Sir Arvin Ong, dalawang smiley pa po. So talagang masakit yung ulo. Ano po? Kerry lang po for Zamboanga City. Hello naman po. Full force po sila. Isang screen lang po, I believe. Ayan. Thank you po. Ayan, mga smiley din po. Draining ang exercise 3, mag-iisip ka talaga. Talaga pong ginawa yan to para para po talagang tumatak sa inyo kung ano yung mga dapat po gawin. How to identify presumptive TB. Ayan po. And ano po yung mga course of action natin. So with that, let us move forward to our exercise 3. Ayan. So konti lang po ito, no? We have 15 cases. Ayan, may comment pa si Ma'am Sheng. Dealer mode, 1 AM, budlat, pahirapan ang pag-access. Wala kasi na-send sa email at mobile data po ang puhunan besides from nag-work ang neurons sa brain. Ayan. So, hindi po namin sinesend sa email yung exercises, yung link lang po yung sinesend namin. So, our exercises, alam po ng lahat na naka-Google Docs po tayo in accomplishing it. So, maraming salamat po once again. Ayan. So, okay, let's proceed. Exercise 3, identifying presumptive TB. We have case number 1. Oh, instruction first. Okay. Identify which of the following cases is a presumptive TB. So, if presumptive TB, assess if presumptive DSTB or DRTB. Then, identify what will be the next best course of action or clinical decision. So, our first case, patient KLH, 34 years female, who took only 3 months of the STD treatment last year, was referred to your treatment facility. She complains of persistent cough for the last 4 weeks with back pain, hemoptysis, and weight loss. So, is patient KLH presumptive TB or not? And if yes, is she DSTB or DRTB? And what is your course of action? So you may answer yes or no, then comma, DSTB ba or DRTB, then comma ulit, your course of action. Ayan. Sabi ni Doc Susan Rigoli, yes, DRTB. Sabi ni Ma'am Connie, yes, DRTB. And then do expert MTB riff test. Ayan. So yun po yung sagot ng karamihan. Maraming salamat po. Our correct answer here is yes, presumptive TB, and in fact, presumptive DRTB po si patient. And what we do next is that we collect sputum and subject it for expert testing. Ayan. Moving forward, case number 2. Patient JSP, 61 years old, having cough for 10 days, came to your clinic with complaints of chest pain, difficulty of breathing, and fever for 3 days. He received DSTB treatment last year and was declared cured. His chest X-ray result showed fibro-reticular infiltrates in the visualized lung areas with an intervening cavity seen in the right upper lobe due to PTB. Is a patient a JSP presumptive TB or not? Or is he the STB or DR? What do we do next? Okay, according to Ma'am Mila Grace Macrohon. Hi, Ma'am Mila. Thank you for joining us. Yes, the RTB and refer for gene expert. Ayan. So the correct answer here is, again, the patient is presumptive DRTB and we have to collect sputum again and submit for gene expert testing. Ayan, very good po at natatandaan yung tamang sagot doon sa ating mga exercises. Let's move on to case 3. Patient OCM, a 4-year-old boy was brought to your facility. The child has been experiencing cough for 3 weeks, unexplained fever for 2 weeks, and loss of appetite. He was given a full course of antibiotics, but no improvement of symptoms were noted. The child has no history of any TB treatment and could not expectorate. Chest X-ray result revealed bilateral infiltrates on both upper lobes. What is your answer? Ayan. Okay. May nakalagay po ba na nakainom ng gamot ang patient? Ang nakalagay po dito ay no history of any treatment. So, the correct answer here is the patient is presumptive TB but DSTB lamang po. And since hindi po maka-expectorate ang bata, no, kung maaari ay gastric aspirate po yung specimen na i-collect po natin. Ayan. DSTB, bakit po DSTB? Kasi 2 weeks, 3 weeks po yung cough, and then 2 weeks po ang fever. Ayan, then may loss of appetite din po. And then further, hindi na din po nag-respond sa antibiotic. Okay, so tama po yung mga sagot ninyo. Okay, moving forward. Case number 4. Patient GYM is a 34-year-old housewife. She lives with her husband and 3 children in an apartment. She came to the clinic because of enlarged cervical lymphadenopathy, non-painful, 7 days of fever, cough and back pain, and with no history of TB treatment. Upon interview, however, you found out that her husband is a confirmed MDR-TB patient. Key in your answer. Okay. Salamat po sa mga sumasagot. Ayan. So may sumagot po na DSTB lamang. Ayun, pinalitan ni Mamila, ni Mamayla. Mayla po ito, no? Ayan. DRTB. Yes, DRTB according to Ma'am Jo, do expert possible biopsy. Okay, so the correct answer here is presumptive DRTB po, si patient GYM, and we will do expert po. Since she is a close contact of an MDR-TB patient. So if you notice, paulit-ulit po nating nire-repeat yung ganitong scenario po, ano? Para ma-familiarize po talaga tayo sa kung sino si presumptive DS, sino si DR, at kung ano po yung gagawin. Moving forward to case 5. Now we have RJH, who was recently diagnosed with pulmonary TB and completed 6 months of anti-TB treatment about a year ago. So he sought consult because of 3 weeks cough and 4 days lamang of cough. Okay? What is the answer for case 5? Natapos na po niya, no, yung gamutan for 6 months last year. Pero mukhang nagpapakita ng senyales dahil may fever po siya and cough. So, the correct answer here is ganun pa rin po. Presumptive po ang ating case. Presumptive DRTB in fact. And again, we will do expert. Ayan. So, for case 6, patient MEB, 44 years old, is a public school teacher who consulted at your clinic because of 15 days of cough and low-grade fever for 7 days. She has taken anti-TB drugs. Yung mga ininom niya po ay isoniazid, rifampicin, pyrazinamide, ethambutol, and levofloxacin for 2 months from a private physician last year. So what is the answer here? Masasabi po ba nating presumptive TB si patient MEB? Kung oo, DS po ba o DR? Ayan. And what shall we do next? So the correct answer here is definitely the patient is presumptive DRTB, and we will refer or we will collect sputum to submit for expert exam. Yan. So nangangalahati na po tayo halos sa ating exercise. We have case 7 with patient KBL. A call center agent has been coughing for 8 days upon consultation. She verbalized having fever at night for 5 days and chest pain. She has no previous TB treatment nor TB exposure to anyone. So I believe ito po ay nasa exercises ninyo, pero hindi po nabanggit itong upon interview. You found out that she has DM type 2 and is now on metformin for 2 years now. Tama po ba? Now, hindi po nakopy, nakaligtaan po itong second statement na ito. So, definitely, ano po yung magiging sagot natin dito? Considering the mentioned details po. Okay. 5 days lamang ang fever and chest pain. Ayan. DSTB po ba ito kahit na hindi umabot ng 2 weeks? Or presumptive TB po ba ito? Or not? And then we should just proceed na i-assess further for other for other health condition. Ayan. So the correct answer here is yes. So again, since the patient is immunocompromised, may risk factor po siya for diabetes at umiinom po ng metformin, the patient is considered presumptive DSTB. Ayan. Okay, moving on. Case 8. Patient FOJ is a 72 years old male and has coughed for more than 2 weeks. He came to your clinic with complaints of chest pain, difficulty of breathing, and fever for 3 days. He has no previous TB treatment nor TB exposure to anyone. Ano po yung sagot natin dito? Meron po tayong senior citizen. Ayan. Okay. So the correct answer here is yes. Presumptive DSTB po ang ating senior citizen. Ayan. Kasi yun nga po, 2 weeks cough, clear naman po yung mga details natin. And then, collect sputum for expert testing. Ayan. Now, we have case 9. Patient RMD, 23 years old, who is being treated for HIV in one of the treatment hubs in Metro Manila, has been experiencing cough for 7 days. He has no previous anti-TB treatment and has no DSSM done prior to referral. So, what is your answer here? According to Mama Rachel of Zamboanga Sibugay, yes, DSTB and then do expert. Same answers from Ma'am Connie, Doc Susan, Ma'am Bambi, and Ma'am Jo. So the correct answer here is presumptive DSTB. Si patient RMD. And then again, we will collect for expert testing. Okay, lapit na po tayong matapos. So this is already case number 10. And we have case or patient HLI. He is a 25-year-old female who came to your facility with fever for 4 days and cough for 15 days. She has no history of previous anti-TB treatment nor TB exposure to anyone. And the patient is non-smoker. What is your answer? Mhm. Yes, the STB. And then for expert, I think we have a unanimous answer here. So the correct answer here is, klaro naman po, yes, presumptive DSTB, si patient HLI. And we will collect sputum for expert testing. Ayan. Okay, moving forward to question number, or case number 11. We have patient SDS, a staff nurse in a rural health unit. She has been experiencing cough for 10 days, accompanied by body malaise and on and off fever. She has no history of anti-TB treatment. Is patient SDS presumptive TB or not? And if yes, TSTB or DRTB po ba? And what shall we do next? Yan. Sige po. Sagot po. No for chest x-ray. Sagot ni Ma'am Jo. The rest answered yes. DSTB. Si patient SDS. The rest answered yes. DSTB. Then proceed to expert testing. Okay, according to Ma'am Lovilla, yes, DR, and then do expert. Okay. So, the answer here is that patient SDS is a presumptive DSTB, and we shall do expert. But we have a recommendation here that once again, we are emphasizing that if we are advocating po na i-x-ray annually ang mga healthcare workers. And also, possible actions po natin dito ay we can start antibiotic for possible bacterial respiratory tract infection po. So, physician's decision po whether to test as presumptive TB, no? Yun na po yung, yun po yung decision na gagawin na po ng physician natin. So, the physician may decide based on best clinical judgment po. So, yun. Okay, last 3 case po tayo. Ayun, may sagot na ulit. Okay, may question po tayo from Doc Berson. Bakit po presumptive si healthcare worker na 10 days pa lang yung cough niya? So, sa bago pong MOP, Doc, kasali na po ang mga healthcare workers na high risk po for having TB because yun po, exposure to, nag-range po kasi sa presumptive or even confirmed TB cases yung nakakasalamuha po sa health center. That is why in the 6th edition NTP MOP, the healthcare workers are already considered high risk, and it means cough of any duration po is considered being presumptive na po of TB. Ayan. Yun po yung ating explanation for that. Okay? But it was not emphasized kung nasaan assignment niya as RHU staff po. Okay, so another scenario po ito. But it is considered healthcare worker, Doc, even nga po ating mga utility workers ay nasa MOP po na at i-x-ray po natin annually, lahat po are no exemption. So for this po, healthcare workers particularly are already po considered po high risk po for presumptive TB. So pwede po nating i-check po ulit, and at the end of the training, we will be providing for those po who ask for the complete or the manual po procedures for TB, we will be providing at the end of the training po. para po ma-discuss po natin lahat muna from modules 1, 2. Okay, we have clarification from Dr. Sa manual po under letter C screening among healthcare workers, all healthcare workers, 2 weeks cardinal signs po ang nakalagay. So, expose, sabi ni Ma'am Lovilla, expose. Okay. Yes, Doc, we already sent rather the manuals, the modules rather, that is in PowerPoint. So para hindi lang po ma-spoil po yung entire training duration po natin, yung ating training month, that is why at the end na po namin ipro-provide. So we can focus po sa ating methodology po na talagang focus po tayo module per module and then discussion po ng answer. Then finally, we will be emailing the entire manual po. So one moment po, we are going to verify this. Thank you, Doc Susan, for your clarification. So we have here request again from Doc Berson, kahit partial na lang kasi di ko masundan ang PowerPoint. I'm not sure, Doc, if we could parang chop the module if we can edit or we can do that para mabuo siya. We will explore, Doc, kasi naka-PDF siya and if it's really a document na controlled and we cannot convert it to Word, so definitely we can't do that unless talagang isi-screenshot isa-isa, which will really take time for us. And besides po, I did not remove po the notes. Kung mapapansin niyo po, may mga, hindi ko po tinanggal yung mga notes na nasa PowerPoint. So you can follow po yung mga little details po sa ating training. Okay. Okay, so mayroon regarding clarification po ni Doc Susan sa letter C lang po, no? Okay, one moment please. Okay. Kung makikita nyo po, andito po ako sa procedure. If I could just scan this through, I will also look for this sa ating PowerPoint. Doon po, kung mapapansin ninyo, okay, let me just share my screen na lang po, or share my PowerPoint. So isa-isa po nating sagutin, no? May mga question pa pong sa chat box, but ito po munang question on bakit po kasali ang healthcare workers sa CAF of any duration po ba yun na tanong? 2 weeks. Ayan. Oh, okay. Oo, tama yan na. With any of the four. 2 weeks talaga. Anong question nga yung tayo nag-stop? Yan na ba yun? Ay, hindi. Case na nga pala. Ito, si patient na... Okay. One moment po. Hello, good afternoon again. We're back. So, nag-stop po tayo sa case 11. Ayan. So, that is why po meron po tayong points for discussion dito or possible actions na case 11 na pwede pong magbigay ng antibiotics for possible bacterial respiratory tract infection. And nasa discretion na po ni Doc whether to test as presumptive TB healthcare workers. Ayan. And we suggest na back-upan po ito ng chest x-ray screening. Or ayun po, chest x-ray examination po. Yun. And number 7. Ayan. So, ito po, si case number 7, si call center agent, may mga nagtanong po na dapat ang answer no, hindi siya presumptive TB kasi hindi present ang 4 cardinal signs. So, ito pong second statement natin na diabetic po yung pasyente ang indication po na presumptive TB patient si KBL because for high risk groups, may diabetes po, may cancer, mga other conditions, immunocompromised, PLHIV, they are considered po presumptive TB with cough of any duration po. Ayan. So did I answer the question po? MUI? So, ayan, thank you so much, Ma'am Jo. In the exercises po kami, po kasi hindi po nakalagay itong second statement. So, wag po tayo ma-confuse. We are talking about this exercise specifically. So, DSTB, presumptive DSTB po si KBL because yung ating naging key detail po dito is she is a diabetic patient po. Okay. Okay, sige. Ayan, kung yun po yung concern po nila. High risk po si KBL kasi may diabetes po siya. Okay? So we are checking po ngayon sa Google Form kung na-omit po ba itong DM. Ayan. So yun nga po, we corrected it earlier na hindi po to nasulat. So ngayon, referring to the exercises, this particular patient, we are declaring this as presumptive TB because diabetic po siya. But pag wala po ito, since wala po ito siya sa statement ng exercises, tama po kayo na patient KBL is not presumptive TB kung hindi po siya naging diabetic. Ayun po. Okay na po ba lahat? Malinaw na po ba? O, bonus na lang daw po yun. So we will automatically ma-adjust naman namin yun since naka-Google Docs siya. We will correct the answer po and then madadagdag po siya sa points nyo. Ayan. Okay. Maraming salamat po. Anong case na po tayo? 12 na po. So maraming salamat po for your active participation at talagang hindi din natin makakalimutan ang mga details dito, no? Kung talagang natatanong, talagang kina-question po kung bakit ganito ganyan. So we really appreciate po. So ito 12, 13 na po. Ayan. Okay, moving forward to case number 13, ACB, 12-year-old child referred to your clinic because of one-day cough. Weight loss was noted because he is not eating regular meals due to school assignment. Is ACB a presumptive TB? Yes or no? And if yes, DS or DR po ba? And what are we going to do next? Ayan. So karamihan po sumagot ng no. No, why po? Dahil talagang stress lang po sa online class, si patient ACB. Ayan. So the correct answer in this case is no. So what are we going to do? Surveillance na lang po and the patient can proceed po for evaluation further for other disease. And so surveillance na lang po natin, obserbahan. Okay, we're down to our last two cases. For case number 14, PMN, 32-year-old male, has chest x-ray findings on infiltrates on right upper lobe. The x-ray was done during a medical mission activity. The patient is asymptomatic. On further interview with patient, he said that he has been non-compliant with his diabetic medications. What is your answer po? According to Ma'am Shirley, yes, DSTB. Ma'am Jo answered yes, DSTB, and then do expert. Same answer with the rest. So the correct answer here is indeed presumptive DSTB CPMN, and we shall collect sputum for gene expert testing. For our last case, LJB, 28-year-old male, has been having problems of recurrent findings of pneumonia in a series of chest x-rays taken thrice in a period of 2 months. He was given 2 courses of antibiotics, but the chest x-ray findings were still there. He is applying for a permanent position in a company. On further interview, he said that he has on and off cough for almost 3 months, but with minimal phlegm. He cannot recall any previous treatment with TB. So, is patient LJB presumptive TB or not? If yes, yes or DR po ba? And what is your course of action? So, ang ating key details po dito ay on and off cough for 3 months na, not responding to antibiotic therapy, may chest x-ray findings ng pneumonia. He cannot recall any previous treatment with TB. So the correct answer here is LJB is a presumptive DSTB. So we shall collect sputum and have it tested for gene expert. Ayan. So that ends our exercise 3. Nasagot po ba yung mga tanong? Meron pa po bang confusion? Meron pa po bang on your end clarification po na may nabasa po kayong kailangan i-point out? So, thank you din po, Doc Susan, for your active participation. And Doc Person, of course, of EPIL MHO. Thank you to Doc Earl. Okay, at this point po, don't leave the meeting just yet. We are going to flash here a few reminders. Okay. So congratulations for completing the week 1 of our month-long NTP 6th edition MOP training. So for next week, that's September 14 to 18, I am going to reiterate once again our schedule. So we will be discussing about Module 4, TB diagnosis, Module 5, drug susceptible treatment, Module 10, TB preventive treatment. Again, every Thursday, we are going to send to you the link of the exercises for Module 4, 5, and 10. And then we will meet again on Friday, the same schedule po. So 2 to 4 p.m. pa rin po for Zamboanga Sibugay, Zamboanga City, Isabela, Basilan, and Sulu Group. And again po, every Monday pa rin po, i-upload yung mga lectures, videos, and then kasabay po nun yung PowerPoint presentation. Ayan po. Have again Monday, Tuesday, Wednesday to go through it. And then we shall have our exercises again. But we have special announcement to make about the exercises. So completion of the exercises is extended po until Friday before 10 a.m. So this is to cater po our participants who are from GIDA, yung mga walang internet connection po, even those who cannot answer the exercises kasi masyado pong busy sa areas. So, makikinig naman po kami sa mga hinaing ninyo, and we are very flexible since this is the first time that we are going to conduct a blended training. So, we will be accommodating po your request. But sagad na po ito ha, Friday before 10 a.m. para po naman ay may time kayo pagka Friday morning to answer it. So we have a chat here. Pwede ang exercises i-send sa Wednesday. Okay. Sige po, we can do that. We can already have it accessible po by Wednesday and Wednesday afternoon po. And I would like to ask everyone po to, if you are not a member or if you are not included in any group chat, we have a group chat po for NTP-MOP per area. So we have a group chat for Zamboanga City, and then we have for Isabela. And we can add you po there for you to stay updated. Nandyan po, nagsasend po kami lagi ng social media cards. We send the links of everything po and lahat po ng updates. Links ng exercises, links po ng ating Zoom meeting every Friday. So, yun po. So, if you added po sa mga group chats na yun, please po key in your Facebook name na lang dito sa group chat and then we will find you. We will hunt you down po and then i-add po namin kayo sa group chat. So, name and area po. Name/area. Facebook name. So, for example po, Isan Halilu, that's my Facebook name, and then / Zamboanga City. So, ganun lang po para hanapin po namin kayo. Para hindi na po tayo, kasi madalas po ang complaint po na natatanggap namin ay walang nare-receive na email. Ayun po, yun naman talaga yung madalas na nare-relay sa amin. So sige po, chat niyo lang po yung FB name nyo and your area of assignment. Ayan. So, ayan po, please check po lagi ha if ever yung emails po ninyo and group chat. So with that, thank you very much for your kind attention and for actively facilitating or rather participating in this discussion of modules 2 and 3. So I really appreciate it. But hold still, we would like to ask everyone to please open their camera. We will do photo ops po. Picture po tayong lahat para may documentation po. Ayan. Sige po, buksan po yung cam. Tawagin po yung mga kasama na nag-a-attend ng training. Sige po. Ayan. Bukas po lahat. Sige po. Tina-tiles view lang po namin yung aming main computer so we can see everyone. Okay, one moment po. Okay. Ayan po. So, everyone, we can see it, Doc Ivy. Hi, Doc. Bukas po ay yung inyong phone. Pwede po mabuksan. Saglit. Okay. Magbubukas din po kami. Guys, come here. Ayan. So, ayan po. Everyone, sa first plate po muna tayo. Nakikita po namin si Sir Vladimir, ang ating EPL Jail personnel. Hello. We have Sir Sajid. We have Zamboanga City Jail. Ayan. Kayo po yung ngingiti muna. Hi, Ma'am Juvie, Ma'am Bambi, Doc Myra, hello. Regina. So, si Ma'am Krizan. Hello, Doc. Shalhua. Sir RH Humalangas, hello. Sir Adel, hello. Ma'am Mila. Okay, smile po muna lahat. In 3, 2, 1. Okay. Ayan. So, one moment po. Okay, next plate, we can see Susan, finally po. Ma'am Shirley. Okay, we have Doc Medina, ZCMC, CMC Treatment Satellite. Hello, Ma'am Charmaine and everyone there. Ma'am Kina, we have Ma'am Katay Binondo. Bukas po ba kayo? Hi! San Ramon Prison, Ma'am Cathy. Zamboanga CHO, of course. Hello, hello everyone. Hi po. Hi, Sir Claudio. Ayan, so bukas po ba? Hi, Ma'am Pats. Hello, hello. Doc Berson, hello. Sir Montaño. Ayan, so okay. Hi, Ma'am Joanna Lu of Zamboanga, Cebu, guys. Ayan po, sige po. Bukas na po tayo ng cam and we will take a screenshot in 5, 4, 3, 2, smile. Okay. Maraming salamat po. We have our next plate. Last plate po. Ayan. So, medyo wala na pong tao sa last plate natin. But, sige po. Ayan. Screenshot na lang po namin. Ayan. So, with that, we would like to thank everyone who joined. And every Monday po, please access the modules and read through. And we will see you po every Friday again, same time. So, maraming salamat po and keep safe po everyone. Bye and happy weekend. Bye po. Thank you.